Welcome back to the Deep Dive. Today we're opening up a conversation about something that a lot of people deal with, often very quietly, health anxiety.
Mm-hmm.
It's that constant feeling, that little suspicion maybe, that even a tiny thing your body does, like a missed heartbeat or a muscle twitch, maybe a small pain,
Hmm.
is actually the first sign of something really, really serious.
Absolutely. And that internal battle, which can be just exhausting, that's exactly what we want to dive into today. Our goal here is to take these really complex, overwhelming health worries and sort of simplify them using what our sources tell us so that you, the listener, feel informed and really importantly, feel supported.
Okay, so let's start right there. What is health anxiety?
Mm.
Just in simple terms for everyone listening.
Mm.
It's basically when the worry itself, the worry about being ill or maybe getting ill in the future, it just becomes so big, so consuming that the worry takes over your actual life. It stops being, careful or responsible, and it starts to feel almost paralyzing.
Yeah, paralyzing is a good word. And the sources we looked at are pretty clear about this. This isn't just general nervousness, it's often very closely linked to obsessive compulsive disorder, OCD, because when that fear of illness turns into a compulsion, like the constant need to check your body or always asking others for reassurance, that's when the exhaustion really kicks in. The worry itself effectively becomes the disorder.
Okay, right. So let's unpack that a little because
Yes.
being health conscious is generally good, right? We're told to pay attention to our bodies. So how do we know? How do we tell the difference between being careful and having this worry really take control, become a clinical thing? What are the signs?
Well, there are some clear patterns, recurring behaviors we see. The main one is probably that constant sort of low-level hum of worry about your general health. It's not just a fleeting concern, it becomes this ongoing state of vigilance.
Vigilance. And that takes work, right? It shows up in actual physical things people do.
Exactly. You see a lot of repeated body checking that could be, obsessively feeling for lumps, tracking every little ache or pain, really focusing in on tiny sensations like tingling,
Yeah.
just constantly analyzing every little shift inside your body all day long. And this checking, it actually feeds the fear instead of calming it.
And then there's the whole digital side of it, which I think almost everyone can relate to now. It's not just checking your body, it's the endless searching online, right?
Sure.
Googling symptoms, that infamous Dr. Google spiral where, you start with a simple headache and suddenly you're convinced you've got some rare, awful disease.
Oh, absolutely. That digital search is a compulsion too. It might give like a tiny bit of relief for a second, but then the fear often comes back even stronger. And what's also really key here, sometimes it's the opposite. It's avoidance. So some people will go out of their way to avoid medical shows on TV or news about illnesses, even conversations about health, because they know it'll trigger this massive wave of intense fear almost instantly.
Wow. Okay, so you got the checking, the Googling, the avoiding. And then if someone starts acting as if they're already sick, even without a diagnosis, that must change their daily life quite a bit.
Hugely.
Yeah.
Yeah. They might start, say, avoiding exercise because they're worried it'll strain their heart or some other organ. Or they might pull back from social events, maybe thinking being around people is too risky, too much exposure. They basically start limiting their whole life based on this fear of a future illness that might not even be real.
Okay, this brings us to something really crucial, that vicious cycle you mentioned. What's so important for you listening to understand is that the anxiety itself, it creates real physical feelings. These aren't imaginary. We're talking about genuine headaches, a heart that's actually racing, real tightness in the chest.
That's right. Because when your body is stressed, it releases hormones like adrenaline and cortisol. And those chemicals have real effects. They speed up your heart rate, they tighten your muscles, they can mess with your digestion. So when someone feels those very real physical things like that chest tightness, their anxious mind immediately jumps to, see, this proves it, I am seriously ill. And that thought, that fear, just ramps up the anxiety again, which makes the symptoms even stronger, and it locks the person in this really exhausting loop. The physical feelings are absolutely real, but it's the interpretation of those feelings where the anxiety lives and thrives.
Right, the interpretation is key. To make this really clear, let's look at an example from the sources. There's a case study of Ravi, a 28-year-old teacher.
Yeah, Ravi's story is a perfect illustration of this trap. He kept feeling chest tightness, which, as we said, is a classic anxiety symptom. Understandably, he got very worried. He saw several doctors, had multiple ECGs, lots of tests, and every single report came back completely normal. No heart problem.
Okay, so he should feel relieved, right?
Right.
But that's not what happened, which is the defining part of health anxiety. Instead of relief, Ravi's fear just kind of shifted. He became absolutely convinced the doctors must have missed something small, something hidden, but fatal. And this constant, unshakable fear started affecting everything. His focus at work, his teaching suffered, he couldn't sleep well, his relationships got strained because this worry just consumed him.
Exactly. And the really powerful takeaway from Robbie's experience is that his actual illness wasn't physical, it wasn't his heart, it was health anxiety. It just shows how this condition can really steal your peace, your sleep, your connections with others, even when your body is fundamentally healthy. The impact on daily life is just as real as any physical disease.
That's such an important distinction. Okay, so if the feelings are real, but the cause might be anxiety,
hmm
how do doctors figure this out? How do they separate a genuine physical illness from these anxiety-driven symptoms?
Well, it takes a really careful, systematic approach and also a lot of empathy. Our sources, including the kind of approaches used in places like MedRec Hospital Jehanabad, they describe a sort of three-step process for diagnosis. So step one is absolutely critical. Doctors must first thoroughly rule out any actual serious underlying medical conditions. That's always the top priority when someone comes in with real physical symptoms. Okay, so check for physical causes first. Makes sense. And only after that's done, they start looking at the mind. Precisely. Step two is then about understanding the person's specific thoughts and worries. What exactly are they afraid of? Is it cancer, a heart attack, something else? Getting specific about the fear helps figure out the best way to help. And then step three involves looking at the impact. How much time and energy is this worry consuming? How much of their day or week is spent checking, researching, seeking reassurance? This helps gauge the severity and what level of help is needed.
Okay, that diagnostic process makes sense. Now, thinking about why this happens. Why do some people develop health anxiety? It probably doesn't just appear out of the blue, does it?
Rarely, no. The sources point to a few common contributing factors. Sometimes it starts after a major illness in the past, either something the person went through themselves or maybe saw a close relative or friend experience. That kind of event can leave someone, well, hypersensitive to any potential health threat afterwards.
And we talked about the internet already, but it seems important, that constant stream of scary health news or just getting lost down those online symptom rabbit holes, that can really prime your brain to expect the worst, can it?
Definitely. That information overload becomes fuel for the anxiety. It feeds the fear. Other big factors include just the basic human difficulty with uncertainty. Health is inherently uncertain, right? There are things we just don't know. For someone already prone to anxiety, that uncertainty can feel unbearable. So they try to gain control by constantly monitoring, which paradoxically just makes them feel worse. And finally, you often see health anxiety pop up or get worse during really stressful times. Major life events can overload someone's usual coping skills, and the anxiety kind of latches onto the most fundamental worry: survival, health.
Right. But the good news, and this is really important, is that if you can recognize these patterns, these triggers, you can start to manage it.
Yeah.
So let's pivot to the practical side. What can you, the listener, actually do? What are some self-help steps you can try, starting today, to break that cycle?
Yeah, the key is really about changing the behaviors, because if you can stop the compulsions, the checking, the searching, the anxiety eventually starts to lose its grip.
Okay, so step one is probably awareness, right? You need to see the pattern first. And the suggestion is keeping a diary. Basically becoming like an objective observer of your own worry. Making a note every time you check your body, or Google a symptom, or maybe ask someone, am I okay? Does this look okay?
Yes, and the diary isn't just for tracking. The idea is to then set a small goal to gradually reduce how often you do those things. So if you checked, say, 10 times today, maybe tomorrow or next week, you consciously aim for just 8 times. It's like building a muscle that resistance takes practice.
Okay, tracking and reducing. Then step two sounds like it tackles the thoughts directly. Challenge your thoughts. The idea here is to kind of externalize the worry, like write it down, maybe 2 columns, one for the worry and one for a balanced thought.
Exactly. This is a classic cognitive behavioral technique, and it can be really powerful. So in the worry column, you might write, this headache definitely means I have a brain tumor. Then in the balanced thought column, you write something based more on reality and evidence, like, okay, hang on. Headaches are actually really common. They're often caused by stress, or maybe I didn't drink enough water or sleep well. I'll try drinking some water and resting first before jumping to conclusions.
Right. It stops that automatic jump to the worst case scenario and tries to ground you a bit more in reality.
Then the next steps focus more on distraction and getting back to normal life. Step 3 is keep busy. So when that urge to check or Google feels overwhelming, the idea is to actively do something else. Go for a quick walk, Call a friend, maybe someone who understands what you're going through, or just get absorbed in a hobby like cooking or reading something engaging. The goal is just to shift your focus until that intense urge passes.
And the final self-help step mentioned is about reclaiming your life, essentially. Return to normal activities.
Yeah.
Because health anxiety often makes people avoid things, right? Like the gym or parties, or maybe even travel. So the advice is to gently, systematically start doing those things again, bit by bit. This basically teaches your brain through actual experience that these activities are safe and the threat you were imagining isn't actually there.
That's right. These self-help steps take real effort and discipline. But what's really encouraging is if they're not quite enough on their own to break the cycle, there is clear, structured professional help available.
Right. So if someone sees a doctor, maybe at a place like MedRec Hospital Jehanabad, that understands these issues and they confirm it's health anxiety,
Yeah.
what happens next? What treatments are usually recommended?
Well, the cornerstone treatment, the main approach, is typically cognitive behavioral therapy, or CBT.
CBT. That's a type of talking therapy, isn't it?
Exactly. It's specifically designed to help you identify and then change those unhelpful, anxious thought patterns and behaviors we've been talking about. It doesn't just teach you coping skills. It works to fundamentally retrain how your brain responds when those fears or physical symptoms pop up. It helps you learn to interpret them differently, more realistically.
Okay, so CBT is key. And sometimes medication might be part of the picture too.
Yes, sometimes. Alongside CBT, a doctor might suggest specific medications to help lower the underlying anxiety levels, especially if the anxiety is very severe. That's always a clinical decision, of course. And really important for long-term success is ongoing support, making sure the person has the tools, the self-help strategies, and maybe lifestyle advice to manage things going forward, especially during stressful times.
Okay, so wrapping this all up,
Yeah.
what's the main message we want you, the listener, to take away today?
I think it's this. Worrying about your health is normal. It's human. It shows you care about yourself. It's definitely not a sign of weakness. But when that worry starts to run the show, when it
Right.
controls your decisions and stops you from actually living your life, that's the sign. That's when it's time to get off that exhausting treadmill and look for some help.
Absolutely. And please know, this struggle is incredibly common. You are not alone in this. And perhaps most importantly, it is very treatable. If you heard yourself in Ravi's story, or if these symptoms sound familiar, just take a breath, step back for a moment, and know that finding the right help is possible. And maybe this raises a question for you. Is there someone you know, a family member, maybe a friend, who might be going through this silently? Someone who could really benefit from understanding this better. Yeah, if this deep dive has offered some clarity, maybe some hope for you or someone you care about, please do subscribe. And maybe share this with them. Sometimes just having the right information is the most compassionate first step towards feeling better.
Definitely. Until next time, remember the goal isn't to stop caring about your health entirely. It's about learning to trust your body, manage your mind effectively, and get back to living your life fully. Stay healthy and stay hopeful.